Hey Boobdoc Nation, welcome back. This is Dr. Z. Today I want to talk to you about the news that broke yesterday. Most of you are aware about the Allergan Biocell recall. This is a textured implant that the FDA recommended or requested be recalled, and it was. The reason? Find out right after this. So you all know about Allergan, one of the top 3 implant companies in the world, particularly in the United States. Why was their Biocell textured implant recalled yesterday late in the afternoon? I was notified by one of the implant reps that they were on a call with the FDA who was requesting a voluntary recall of the devices. It turns out that the reason, of course, is for breast implant associated ALCL, which is Anaplastic large cell lymphoma. This is a very rare form of cancer that for the past 7 or 8 years we have known has some type of link with textured implants. The lymphoma is only been identified in approximately 570 women in the world. And of course there are, just in this country alone, over 400,000 breast implant cases per year. So it's an extremely rare form of cancer. However, the linkage does exist, and of those 573 women, I believe it is, over the past several years that have been identified, there have been 33 deaths. All of these cases have been associated with textured implants and never a smooth implant. And in particular, Allergan's Biocell texturing technology has had the great majority of these cases. Why is that? We're not quite sure. There's lots of theories as to why large cell lymphoma might even have anything to do or start to form with at the surface of an implant. It could be that bacteria harbored in the crevices of the texturing have something to do with the origins of this cancer. Nevertheless, 33 deaths, and most of which attributed to Allergan, is enough for the FDA rightfully to say take them off the market. So what does that mean to you? If you have an Allergan Biocell textured implant and no symptoms at all, there's nothing to do. No worries as of this moment. You need to monitor closely, but you don't have to rush out and get your implant taken out. If you do have symptoms, regardless of what kind of implant you have, but particularly if you have this implant, then you should talk to your plastic surgeon right away. And the normal protocol for symptoms, which include fatigue, sense of malaise, as well as the most key sign is swelling around the implant. It could happen a few months after surgery. It could more than likely happen years after surgery, where you'll develop what's called a seroma, or a fluid collection around the implant. If you have such a swelling arise, it should be examined. Ultrasound guided biopsy of the fluid should be performed and checked for cancer. The good news is that when it's identified, this has a very high cure rate. The implant can be removed. All of the fluid is of course removed, and the entire capsule must be removed too. The capsule is that scar tissue that forms around the implant. And so once all this is done, the cure rate is over 90%, permanent cure rate. However, if it's not taken care of, the cancer can spread, as cancers do. This is one of the reasons, among many others, that I've never preferred to use textured implants. I actually only use smooth implants, and it's not just because there's an extremely tiny little risk of having cancer, because that's important, but it's also because of the way that they feel, which is less natural. They are usually less mobile in the pocket because that texturing tends to act like Velcro. There's a higher risk of infection, of course. So I always have had great success with smooth silicone gel implants, and that's what I assume that most people who have had some use of texture implants in their practice will probably be switching to in light of this recent news that occurred yesterday. So I hope this has been a helpful update to you and that you understand a little bit more about textured implants, BIALCL, and the recall that occurred. So please comment below with questions. If you have any questions at all, whether you're a patient of mine, if you're a patient of anyone else's, if you're inquiring about breast implants, if you have any questions regarding this issue, please leave the comment below and I will reply to you personally as soon as possible. Thanks a lot. Take care. Boob Doc fans, see the link in the comments section below to find out how you can get your own feel-good t-shirt and support breast health and cancer research.